It was a great year for our program, a great year for our patients. With 70 transplants, that was a record in the state of Florida. We are now a top 10 program in the nation in terms of volume. Our survival is excellent in terms of post-transplant survival, and also another key component of our strength, I think, is the waitlist mortality. We have the lowest waitlist mortality in the country when you take into account programs with moderate or large volume of transplants.
What we've seen is that other centers, they have declined patients, for different reasons. It's high risk, high complexity, and they end up being referred to us.
Our team has the expertise and capability to take care of these patients who are extremely sick.
So obviously, if we are growing the number of transplants we're doing, we're having to have access to more lungs. So what we have been doing is several processes that we put in place to be able to bring more lungs to our patients, and they go from being more aggressive on donor lung selection, going more often to the donor site to evaluate the lungs by ourselves, and then it goes from a spectrum to doing all of that to what we call the ex vivo lung perfusion, which is this technology that you're able to bring the donor lungs to your own site and assess them on a specific device. And oftentimes what we see is that conditions that were concerning in the initial donor evaluation, they improve, and these lungs they turn out to be excellent quality donor lungs. Another technique that we have been using here at our lung transplant program is what's called Lobar transplantation. So if you think that oftentimes when we list patients with short stature, it is difficult to be able to match donor lungs with their size. So what we have been doing here is an advanced technique that we basically resize the donor lungs, and we, instead of transplanting the entire lung, we transplant a lobe. And that has helped a lot on these patients, specific ones with short stature, in terms of reducing their weight and also preventing them from dying on the wait list with never having access to donor lungs. So I think age is another extremely important aspect to discuss about lung transplant candidacy. We are seeing older patients, they're getting to their 70s, 75 years, that the only problem that they have is their lungs. So their hearts are healthy, they are strong, their bones are strong, they are conditioned. So these patients nowadays, they are the fastest growing population receiving a lung transplant. So patients older than 65 and also that have interstitial lung disease.
Seeing the program the way that the way that it's going, and it's very satisfying because we see, like, when we go to a bedside, see the patient doing well and seeing how that life has been changed.
It all comes to the more you do, the better you get on that. So we're able to establish a team that works as a whole to provide the best care possible.